Chiropractors or physical therapists? What's the difference? Is one better than the other? Which one do you need to get feeling better and to get back on your feet? Let's talk about it. Hey guys, Aaron Kasner, Doctor of Physical Therapy. Today we're going to talk about the difference between chiropractors and physical therapists. Now let's go ahead and get this out of the way. I'm a physical therapist. Obviously, I'm going to have some biasness towards physical therapy. I don't always think physical therapy is better, but I would prefer people to choose PT over chiropractic care in certain situations. So let's figure out what the situations are, the difference between PTs and chiropractors, and some of the similarities between the two. All right, first things first, let's talk about manipulations. Those big cracks that you hear, the back popping, the neck popping, those big ring dingers that we see on YouTube where the chiropractor takes their neck and cracks it all up, and it sounds satisfying, it feels satisfying, and the provider doing it probably feels satisfying getting that pop, right? Now, why do chiropractors do this? What's the reason for it? Now, my understanding is they believe if the spine is in perfect alignment, everything else will be better. Now, there's some older beliefs of chiropractic care where they could cure other things such as the flu and things like that. That's old stuff. I don't think that's really practiced as much anymore in chiropractic care, but maybe there is still some belief in that. I am unsure of it. Now, physical therapists also do manipulations, but we kind of look at it in a different way. All right, I don't believe that popping your back and getting it into a correct alignment is going to fix everything. I think it's part of the treatment. I think it can be something that's very good to use, but I don't think it's everything. I don't think we just pop your back and send you on your way and then have you come back in a week and pop it again. What I want to do as a physical therapist is I want to get you into a better position, joint, if it needs a manipulation or a mobilization, I'll do that, but I want to get you stronger. I want to figure out what's causing the issue. That way you don't have to come back, right? Terrible business plan for physical therapists to say, hey, come in, let me get you better, let me teach you everything, and don't come back unless you have a problem. I want you to not have a problem and not see me. Not good for business. Versus chiropractors, with their belief system, they believe they should realign your spine, realign everything, and if you need to be realigned, come back. But it turns into a habitual thing where you go back every week and you need to be popped and you need to be adjusted. Is this truly what you need? That's kind of up to you. It's what you think. If you like to go to chiropractor, spend $20, get your back popped once a week, and you're okay with that, then yeah, that's for you. But if you want to get the problem actually solved and figure out what's causing these issues, you may want to see a physical therapist that can also do manipulations, because if it feels good and you feel better afterwards, but giving you some exercises and showing you some ways to move differently so you don't have to always come back to rely on it. Maybe you go from once a week needing a manipulation to feeling like once every other month or once a year. That's okay, right? And go to the chiropractor for those. Go get your back popped if you feel like you need it. So, do manipulations work? Yeah, right? We hear the pop, we feel the pop, it feels better afterwards, but is it really fixing the problem? Sometimes, okay? I mean, there's times where I've slept wrong, where my pillow moved or my neck was in a weird position for a long time and my muscles were off balanced and it created a point where my joint wasn't moving the way it should. I could potentially benefit from going to a chiropractor, having them look at my neck and then correcting it, as they would say, and getting it back into a better position. I'm going to feel better. That's not a regular thing that's occurring because it just happened to be a fluke of some sort where I just slept in a weird position. I could see an argument where chiropractic care could be better there, right? Now, if I'm habitually having a problem with my neck, I don't really want to go to the chiropractor just to have them pop my neck so I can go back in a week, right? I want to figure out, why is my neck constantly feeling this way? Is there something to do with my posture? Is there something I'm doing at work or activity or school that's not correct and causing these issues for me? Manipulations do work, but it's not the entire treatment, or a majority of the time it shouldn't be the entire treatment. And I don't think you add in e-stim or heat and then your problem goes away. Yes, it feels good. It's like a band-aid for your body, but eventually that band-aid has to come off, and if you're not healed up, it's going to keep coming back, okay? Now let's talk treatment philosophy. How do physical therapists look at treating versus how chiropractors look at treating? Now, again, I'm only going to speak mostly on behalf of physical therapists and how we view things, and I can only touch a little bit on chiropractic care. I've observed chiropractors and I've had chiropractic treatment, but that's not everybody. That's not everyone. Every chiropractor doesn't treat the same way. So comment below if you've had good chiropractic care and some of the things that they did that helped you. Because in no way am I trying to shame chiropractors and say it's a sham. I think there can be a good place for it, but I think it might be being overused in society. Now with physical therapists, I want to treat everything. So if a patient comes in and they're having low back pain, I'm going to look at the joints. I'm going to assess how they're moving. I'm going to assess how they're moving forward, how they're leaning back, side to side, those types of movements. I'm going to find out where they're weak. Okay, I'll check their core strength. I'm going to check their hip strength. I'm going to see where compensations are coming in. I'm going to have them lay down on their stomach and I'm going to assess firing pattern. I'm going to see what muscles are firing and when they're firing. I'm going to see what's testing weak, where the range of motion's at, all of these things. Now in the process, I may say, yeah, you could benefit from a manipulation, get your joints moving a little bit better, get that pain to go down, but I don't stop there, right? I'm going to look at their glutes and say, okay, your glutes are weak. That's the reason why your back's starting to hurt so much, because you're compensating and using your back, not using your glutes. So let's get those glutes firing. Or hamstrings are overactive. So we need to add a little stretch to try to get them to relax a little bit and then strengthen the glutes and get the hamstrings to do less. Or core activation. Your core is not engaging when it should. So we need to get that stronger so your back doesn't take on all the weight. I'm going to do all these things and find a combination of treatments to get you better and back on the road. We're also going to talk about what's causing the issue. Is it going to the gym and working out? Is it working? Is it staying in the same position for too long or having to move in the same way? I want to check out all those things, every aspect of your life that involves your back, and figure out where the misalignment's coming up, where we're not moving in the right way, and how to fix it. Okay? Now, chiropractors, I don't know how much of an assessment they truly do. My experience with chiropractic care has been pretty simple, where it wasn't a whole thorough subjective where I'm telling them all these different things. Yeah, I tell them my back hurts. Maybe I tell them it hurts when I jump, and they may look at my joints and then they do a bunch of pops and it feels better for a little bit, but then it's staying there, right? It's coming back in a week or 2 weeks and doesn't completely go away. So then I think there's something wrong with me, and then I look for surgery, I look for new things to try to get my pain to go away, when in reality, I can change those things myself. My body can change. I can get stronger. I can be better. I can move better, right? But you need a competent physical therapist to be able to do that. And not every physical therapist treats the same way, right? Not everyone will use manipulation and stretching and strengthening and neuromuscular techniques. They may just use certain things. And if it doesn't match you, don't go there. Find a therapist that works best for you. And maybe a physical therapist that doesn't do manipulations, but they feel like it would help. Then see them both. See a chiropractor for some manipulations and then see your physical therapist. Find out what works best for you and what's going to help you get better, okay? Don't rely on the healthcare system to just fix you and cure you, because that's not going to be the best thing. So you're probably thinking, what do I need? What do I need as a patient to get better? And that's a tough call. It really is. I would say figure out who is going to work best for you in the sense of trying it out. Go to a physical therapist. See what's going on. Maybe go to your primary care first, okay? Tell them the issues that you're having. Paint a good picture. Hopefully they will send you to a physical therapist so they can look and see how you're moving, okay? I think PT should be almost a preventative type of healthcare, okay? Before a problem gets really bad. If you're having back pain now and it's minimal but you can deal with it, don't deal with it, fix it. Okay, fix it before it becomes a major problem. Go see a physical therapist. See how you're moving. See what your posture is like. Find out all the things about your body that you didn't know so you can fix it. If you're in a lot of pain and you've had benefit from a chiropractor before and you want to go back, I'm not saying don't. If that's what you like and it helps you, do that. But learn more. Learn more about your body. Treat your body yourself so you don't have to rely on other people. Part of physical therapy for me is educating you. I want you to know as much as you possibly can about your body, which is obviously why I'm doing this channel. I want you to learn, right? I want you to be able to know and figure out what's best for you. Don't let anyone else control your body. You control your body. So what's best for you? I can't tell you that. Only you can figure it out, but you need more information. So watch more of my videos that talks about certain things that you're having issues with. Look at my back section or my knee section or shoulder section, whatever thing that you want to learn more about. Go see a local physical therapist. Do research online. Figure out what you think might be going on. Be careful with the online research though, okay? Don't think that you automatically have cancer because WebMD says, oh, your back hurts in this area. It's probably cancer. It may not be, okay? Now, if you're having some systemic issues as well, go see your primary care. Go see a specialist too. Figure out what's going on. Don't wait, but do your own research. Figure out what's going on and what's best for you. Okay, so hopefully I wasn't too disrespectful to the chiropractic community. No offense to chiropractors out there. I understand you guys have your place. You have your belief system. I have mine. That's fine. That's cool. I'm just very pro physical therapy. I think everyone should try it out. I think everyone should learn more about their body and be better. Okay? Find out what's best for you. If you liked what you learned today, check out some of my other videos. Go to my channel, subscribe. I'm posting things weekly. I'm updating new things, trying to teach people about what they want to learn about. And there's something I haven't talked about yet. Comment below, let me know what you want to learn about, and I'll teach you about it. Okay? Thanks for watching, guys. I appreciate it.